The AMA Moving Medicine podcast highlights innovation and emerging issues that impact physicians and patients today. Hello, this is the American Medical Association's Moving Medicine video and podcast. Today, we're talking with Kimberly Horvath, a senior attorney with the AMA's Advocacy Resource Center in Chicago, about scope of practice and the AMA's efforts to address this important issue on behalf of physicians. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Kim, thanks so much for joining us. The AMA has been working on scope of practice at the state and federal levels for more than 30 years, but it seems to me this is a hotter topic than ever. Why does this continue to be such an important priority for physicians and the AMA?
Yeah, thanks, Todd. It's so great to be here today. And yes, it's hard to believe we've been working on this issue for 30 years, but absolutely it is becoming more and more important each and every day. And I think the main reason is it's a top priority for physicians and for the AMAs is because of patients. Physicians care deeply about the health of their patients, and they care deeply about patient access to high quality healthcare. We know that healthcare has changed a lot over the past 30 years, but more than ever, we know that it's important about physicians-led care and making sure that patients have access to physician-led teams. And I think it's also one of those issues that spans the spectrum of physicians that care deeply about it, from medical students and residents to new physicians or physicians that have been around for a really long time as well and established practices. Spans across specialties, spans across types of practices as well. So certainly one that all of our members care deeply about.
It's interesting, just to kind of key on something you said. I mean, we have a very clear idea. You mentioned students, residents, physicians, and their views on this issue. But from the patient's point of view, what do we know about how patients feel about this issue?
Yeah, patients play a central role in how we view this issue as well. And we know we've conducted a number of studies over the years and know for sure that patients want physicians leading their healthcare team, and they don't just want it, but they expect it. In our most recent survey, we found that 95% of patients said it was important or very important for physicians to be involved in their healthcare diagnosis and treatment decisions, with 68% saying it is very important. So that's a lot of patients that really think it's important and want to have physicians involved in their healthcare team. And, you know, we know that patients care about their healthcare, obviously, and they care about the cost of care as well. Of course, right? We all do, and I think that we can agree that there's some room for improvement, right, in the healthcare system overall. But patients are really concerned that allowing non-physicians to provide physician-level care is a step in the wrong direction, and they fear that patients are going to be the ones that suffer most should these scope expansions take place.
Well, a lot of this activity in the scope world takes place at the state level, and a lot of the legislative state sessions around the country are just wrapping up. Can you give us an update on the results so far?
Yeah, we've got still about half the states are in session, so can't give a full update, but certainly are happy to report we've had some victories at the state level already this year. And I should pause here and just say that all the work that we do in this area is hand in hand with the state medical associations across the country. We just rely on them so much for their political acumen in this space, and again, work hand in hand with them on these issues. We've worked so far this year with 25 state medical associations on this issue, and some key victories. As I mentioned, I would give you Colorado and South Dakota defeated legislation that would have allowed physician assistants to practice independently without any physician-led care. Mississippi defeated legislation that would have expanded the scope of practice of APRNs. Wisconsin, big victory there when Governor Evers vetoed legislation that would have given APRNs, allowed them to practice without any physician involvement. Big wins in Kentucky as well as Tennessee. Alabama defeated all their scope legislation this year, including legislation that would have expanded the scope of practice of optometrists and would have allowed them to perform surgery. So really important victory there as well.
That is a lot of activity.
A lot of activity, and we're only halfway through. So lots of states are still in session, lots of work that's still going on. Lots of bills that we're still really interested in and working with the states on, and actually gearing up for 2023 already in a lot of states.
Medicine doesn't stand still, and neither do we. AMA members don't just keep up with medicine, they shape its future. Help move medicine, join the movement. Visit ama-assn.org/movingmedicine.
You mentioned the AMA is working, in partnership at the state level with state societies. What is AMA bringing to the table in terms of resources?
Yeah, again, strong collaboration with the states at every level. And we provide lots of support on the way, and it can take many forms. One is providing a lot of the tools and resources that we have created over the years. Things like our modules, our education and training modules that provide a deep dive analysis of the difference in education and training of various physicians and non-physicians. We have GeoMap series, 4,500 GeoMaps over three periods of time. And what these do is they show the practice location of various physicians and non-physicians in a state. And these have been really instrumental in pushing back against the notion that scope expansions are necessary to increase access to care, particularly in rural areas. That is an argument that we've heard time and again in legislators. And what we have found and what we can clearly show in, for example, these GeoMaps is that the practice location of physicians and non-physicians tends to be in the same areas of the state. And it's true irrespective of state scope of practice laws. So clearly scope expansion, laws that expand the scope of practice of non-physicians does not correlate to increased number of non-physicians moving into those rural areas. So the GeoMaps have been really instrumental in pushing back against that notion. We also provide write letters. We have board members that testify, and we are not shy about amplifying, for example, calls to action from the state medical associations, encouraging our members or reaching out to the SOPP, the Scope of Practice Partnership, and encouraging other members and other national specialty societies to reach out and encourage lawmakers to oppose key bills.
Kim, one of the things that I've been reading about in the press is a study that has come out of Hattiesburg Clinic in Mississippi that examined some of these issues around physician and non-physician care. Tell us more about what that study revealed.
Yeah, so Hattiesburg Clinic is in Mississippi, and they've done a study. It's a 10-year study, and they looked at the quality of care and the cost of care provided by patients that saw non-physicians and patients that saw physicians. And what they found is that patients that saw physicians had both a lower cost of care and a higher quality of care than patients that saw the non-physicians. And what they did with the information was really change how they used non-physicians like physician assistants and nurse practitioners in their practice. And now what they do is they alternate care provided by physicians and non-physicians. So patients aren't seen only by a non-physician, for example, but they do have physicians involved in their care on a regular basis as well. And I think it's just a really good example of looking at the data, knowing that we all work as part of a healthcare team, but how best to utilize non-physicians as part of that team. And it is as part of a physician-led team, which again supports AMA policy in this space and what we've been advocating for at the state level on this issue.
So it sounds like on this particular side, AMA bringing a lot of resources on the data front to move this to a data-based discussion. And then in addition to that, there are a lot of resources involved. Talk to us about the Scope of Practice Partnership and what that brings to the table.
Yeah, so the SOPP plays a really important role in our work on scope of practice. And there are 108 organizations that are part of the SOPP. And they've really come together with a common goal of defending the practice of medicine and opposing inappropriate scope expansions. The SOPP has been instrumental in creating some of the resources that I mentioned earlier, like the GeoMaps, and also in providing grants to state medical associations to help them on their work on these issues. Look, we know we can't do this alone. And we know that we are much stronger when we're all working together, which is really the purpose of the SOPP. And they have played a really pivotal and key role in both building up our scope campaign, but also continue to play an instrumental role in, again, supporting physician-led care in states across the country.
Kim, this is clearly a really important issue for physicians, students, residents to be involved with. What are some concrete steps and ways that they can get involved?
Yeah, I mean, first and foremost, become a member of the AMA, but also become a member of the State Medical Association, National Specialty Society. And we know we're better when we're all working together, and we're stronger when we work together. But also get to know your state legislator, get to know your state rep, your state senator, and they should know who you are in a good way, right? And don't wait for a bill to be filed or for a key vote. Like, start this now. Build those relationships. It takes time. Even if you haven't done it before, let today be day one to reach out to your lawmaker and seek out information from the AMA, from your state medical society on these issues, so you can educate yourself about how to approach. But also, don't be shy in providing your real life experiences with lawmakers. I mean, that's the real value that you can provide to them with those experiences, not just on this issue, but on all the issues that are important to physicians. So I think those are definitely some ways. And again, start today.
It is that combination of the facts, and you can't assume that your state legislatures have that kind of research and data that we covered earlier in this, but also, as you say, combined with personal stories of how it is on the ground for patients. Kim, thanks so much for being here today. That wraps up today's Moving Medicine episode. Make sure you don't miss any more episodes of this, because they're terrific. You can subscribe on YouTube or check out all our videos and podcasts at ama-assn.org/podcast. Thanks for joining us, and please take care. This has been Moving Medicine, a podcast by the American Medical Association. Subscribe to other great AMA podcasts available wherever you listen to yours, or visit ama-assn.org/podcasts. I'm Todd Unger, and this is Moving Medicine.